Hi, welcome to my dissertation proposal defense for unlicensed and uneducated dental assistants that create concern for patient safety. My name is Denise Romero and I'm from cohort 8. The problem of practice that I will be studying is unlicensed and uneducated dental assistants creating a concern for patient safety during dental office procedures. This is a crisis that is occurring. Even the most recent events on November 7th, the headline stated that patients in a Pennsylvania dentist office were told to get tested for HIV and hepatitis. Patients were exposed from January 1st of 2007 until September 14th, 2018 to these infectious diseases. These diseases were transmitted from not using proper infection control procedures, which would be performed from dental assistants. Dental assistants have a great responsibility in the dental office. The very first dental assistant in 1885 was hired as a lady in attendance. The dentist, Dr. Edmund Kells, hired her so that the women who the dentist saw would not have to keep their husbands in the room. During this time, he realized that the dental assistant was a great asset and started training her to help him chairside. This has changed significantly. Now dental assistants include very sophisticated procedures that should require education. In California and most of the states, dental assistants are not required to have any kind of training in dental assisting education or have a license to work in the dental office. They can be what's considered on-the-job trained, which is basically anyone off the street, and the dentist can train them to become dental assistants. On-the-job dental assistants don't have the same kind of training that formal education does. Dental assistants are the primary person responsible for all infection control and sterilization in the dental office, also other dental procedures, but this is one of the number one key aspects that we will be reviewing in this study. Formal DH dental assisting programs train to the highest level of infection control following CDC guidelines. An example of something that can happen or occur is deadly bacteria and viruses could live in dental unit water lines and spread deadly bacteria. This is an example of what the dental unit water lines look like if they are not cleaned out on a daily basis. In Anaheim, California, in 2016, there was a deadly outbreak of a bacteria that was caused directly from the dental unit water lines not being cleaned. This was consequences of hiring on-the-job trained dental assistants who had no idea of the consequences because they didn't even know that they needed to clean the dental unit water lines. Over 30 kids were hospitalized. This is just an example of one of the patients who lost part of her jaw and 3 permanent teeth and had to be hospitalized for months to get rid of this deadly bacterial infection that was growing inside of her jaw. The organization that I'm going to be using for my study is state dental boards. They are the agency that governs all of dentistry, including dentists, dental assistants, and dental hygienists. Each state board governs and counts the qualifications for the practice of dentistry. Each state legislation grants authority to the dental board to establish the qualifications for licensure, issuing licenses to qualify for these exams. They qualify individuals, usually through background checks, establishes standards of practice of conduct, disciplinary action, and rules of the board, and the duties that they are allowed to perform. As mentioned before, California and most states in the United States do not require dental assistants to have any kind of formal education or licensing. To accomplish the dental board's mission of To accomplish the dental board's mission statements of providing patient protection, the dental board should make a performance goal that all dental assistants should have a formal education by 2025. This video is showing a dental assisting class how to properly set up dental chairs for dental patient procedures. Each of the students have been trained didactically through lectures and different PowerPoint presentations on how and why they need to set up these chairs to this manner. Also, you will see that each of them are fully in their PPE, their personal protective equipment, while they're setting up these chairs. Each student has to pass a set of competencies on mannequins before they are allowed to even work on patients. During these competencies, they are guided through each procedure. They also have to learn how to clean the dental unit water lines, removing all the bioburden. These are just some examples of the different things that dental assistants have to perform in order to pass these competencies to graduate from the program. As stated before, on-the-job trained dental assistants would get none of this training. They would be put into the office, and however the dentist trains them is all that they would have received. The dental board will be the stakeholder that I will be reviewing for this study. Each of the dental boards have the authority to require dental assistants to have formal education and require licensing before they are allowed to work in the dental office on patients. The research questions I will be using are as follows. They are following the dentist knowledge and motivation on what kind of dental assisting programs are out there, as well as licensing. I will be also following up with any kind of recommendations that they might have for the dental board to be able to utilize dental assistants who are licensed and educated and remove the pathway for on-the-job trained dental assistants. Using the Clark and Estes conceptual framework, looking at the knowledge, motivation, and organization for dental assisting, it is going to require dental assistants to be educated from a formal dental assisting program, require dental assisting programs to be accredited from a national accreditation agency like CODA, which is the Commission on Dental Accreditation, and for all dental assistants to pass a licensing exam before being able to work on patients. The proposed data collection will be using surveys administered to dentists who hire dental assistants. It will be using an online survey and a link for the dentist to be able to fill out the survey. The limitations would be dentists not being honest with their answers for fear of repercussions from the dental board by having dental assistants practice outside their scope. However, a disclosure will be provided explaining to the dentist that everything is confidential and none of the results will be shared. I appreciate your time on listening to my presentation for my proposal defense. Thank you.